Our simulation program has three basic components, all of it geared towards making sure that our residents are well suited to care for whatever they may encounter. We've got our procedure labs, our EKG tutorials, and our simulation sessions that we do here. The main reason we have those three components is because, yes, we prepare you for in-service, yes, we prepare you for boards and your clinical rotations, but we always keep an eye to the fact that we've graduated residents who work in a varying array of centers. We've graduated residents who work in academic centers, critical access centers. We have several residents who are manning the ICUs in rural settings. And so our main goal is that when the pager goes off at 4 in the morning, wherever you end up working someday, as you run towards that room, not knowing what you're going to find, you're well equipped to encounter whatever you see when you open that door because of what we've done here in the Simulation Center. The way that the Simulation Center is designed, and you see our top-of-the-line equipment behind me, is that we have theme days. So every day when we come in, we base it on either hematologic emergencies, sepsis, whatever the theme for that day is, and we have 4 cases with 2 teams, and they sort of compete against each other. We'd like to know the mechanism of certain drugs and how they work, and we can grade them. We make the mannequin more critical or improve based on their answers. Then when we get out, we go over critical actions, and the teams, there's a bit of a fun component to it as they get to go head to head to see which team ended up winning by hitting most critical actions. One of the main components of any good simulation is that the debrief session should actually be probably 2/3 as long as the simulation itself. This gives our residents time to go over questions. Hey, which drug would have been better in that scenario? How come the mannequin decompensated when I did this? And we have a discussion format backed by evidence-based publications so that everybody can improve their skills as to that specific topic. And as we do this with every specific theme we encounter over the 3-year residency, we make sure the residents get stronger in each component, each core component that's needed for the program. Any prospective applicant who comes to our program can feel reassured that we reinforce it with real life scenarios. And so with our procedure labs, for example, yes, it's all well and good to know how a central line kit works, but we go through troubleshooting the complications, what to do when the INR is too elevated, how to reverse before you place your central line. With our SIMS scenarios, we go through what to do when the first line drug isn't available, what to do when the patient is pregnant, when it's a pediatric patient. So these are things where we go over and over trying to factor every possible scenario that they may encounter, and we make them stronger for it.
Sim lab activities are structured in that we get placed into different groups, and then there's 2 sim labs that we use. We go in with our group and either Dr. Omuka or another preceptor, and we do the simulation lab. The rest of the people that aren't in the groups doing the simulation are outside watching us as we're doing it.
It's important to get hands-on learning with simulation because when you're out in the hospital, you have to do these procedures so that way you have the confidence that you've already done it before on a mannequin, so you can easily replicate it on an actual person. The simulation activities that I've completed this year are arterial lines, arterial blood gases, ultrasound-guided central lines. I was also able to do ultrasound-guided peripheral lines and also mimic intubations.
My favorite part of when I'm in the simulation session is that I get to work with my teammates, and it kind of gives you an idea of how it would be in real life when you were doing it. When the simulation lab is over, our performance is measured by going outside and going over the case with Dr. Omuka, and then we go over the steps that we did, and if we did all the steps we get points for that, and if we didn't, we don't get points.
I was able to apply some lessons I learned in the sim lab. When I responded to a code blue, I was the first physician responding, so I was able to know the algorithm to respond to the code and give the appropriate medications and then initiate a shock when necessary. Fortunately, the patient made it out and had a good recovery.
I think receiving SimLab as part of our overall development as physicians is very important because it gives us a way to practice without hurting anybody, and it gives us a way to make mistakes and grow as doctors in a way that we wouldn't be able to otherwise.